Dr. Shirley here. January is National Glaucoma Awareness Month, and I do have a lot of questions here within the practice regarding glaucoma, so I wanted to answer a few of those for everyone here today. The first one, what is glaucoma? Glaucoma is when the pressure goes up on the inside part of the eye and it starts to push on and damage the optic nerve in the back of the eye. The optic nerve is what actually carries the visual signal from the eye the whole way back to the brain, and when that nerve is damaged, it can result in side vision loss. So we start to lose our peripheral or side vision in through here, and if it's really advanced, you can actually have a kind of like tunnel vision, which is not good. Will I go blind from glaucoma? Unfortunately, the answer to that is yes, if it's really advanced, because the vision loss is permanent, and with today's technology, there's no way of getting that vision loss back. Who gets glaucoma? Generally, it is older individuals, but at the practice here, we do like to screen patients of all ages for glaucoma, because if it is detected earlier on, the outcome tends to be significantly better. And a lot of times we can detect glaucomatous changes before you actually have vision loss. And within the office here, we check everyone's eye pressure at every annual exam. I'm sure most of you have had that done before. Nobody likes the test and everyone complains about it. It's usually a puff of air in the eye or yellow dye with a blue light that comes close to your eye. And that's one of the screening tests for glaucoma. It is important to note, though, that there's a small subset of the population that actually has what's called normal or low tension glaucoma. So it's possible that your pressures are within a normal range compared to the rest of the population, but they're too high for your eyes. And there's some other components such as blood supply, and it can be a little bit more difficult to identify and harder to treat in those situations. Also within the office, we have kind of like an MRI scan that looks at the optic nerve in cross-section, and oftentimes that can pick up on structural changes before we have any functional or subjective vision changes that the doctor or you may notice. How is glaucoma treated? Usually, if it's identified in the early stages, it's one drop in each eye at bedtime. That eye drop helps to lower the pressures to a point where it's no longer pushing on the optic nerve that we discussed earlier. And if it's more advanced, it may require additional eye drops or sometimes different surgical procedures to help open up the drainage system or decrease the production of that fluid within the eye. Can glaucoma be prevented? Unfortunately, no, there's nothing in particular that you can do to prevent glaucoma, but the most important thing is that you just have annual eye exams and you see your eye doctor on a regular basis so that we can check and screen for glaucoma and other eye conditions. Yes, that may involve you getting a puff of air in your eye or maybe needing to have your eyes dilated or having yellow dye in your eyes, but it is important because if identified early, it can be treated and won't result in vision loss, hopefully. Thanks for listening today.